All right, hi everyone. I hope you're doing well. So this is lecture video 6 where we're going to talk about exceptional learners. So when we're thinking about exceptional learners, this would be a learner that is out of the norm, if norm is even something that actually exists. So in this particular lecture video, we're going to be talking about students who have extra challenges to overcome. And then in the next video, we'll mention a little bit about gifted learners as well. So when we're thinking about learners who have extra challenges, this is where my background in clinical psychology really informs a lot of what we're going to be discussing. So you'll hear me in the video talk about the DSM, the Diagnostic and Statistical Manual of Mental Disorders. It's the book that we use in psychology to make a diagnosis. So we'll talk about different disorders and the criteria for them in the DSM. So let me know if you have any questions. We will talk about activity 5 in the video. So if you need anything, let me know. Let's go ahead and get started.
All right, so as I said, today we're going to be carrying on with information related to our intelligence lecture. And we're going to start off by talking about some different thinking styles. Now, there is much we could say on this topic, and we will have a lecture video later in the semester that will talk more about advanced cognitive processes and different types of thought, that kind of thing. But briefly touching on this today, some students are more impulsive in their thinking style. And so what you'll see with students who are more impulsive is that they tend to blurt out whatever answer comes to mind first if you ask them a question. And maybe that they do the same kind of thing on their assignments. Maybe these are the students who write down whatever answer comes to mind, or they just go through and they don't really take the time to consider, is this really what the teacher's looking for? Is this really an accurate answer? Just kind of rushing through their thought processes, rushing through their work. On the other hand, there will be some students that are more reflective, where they will take the time to read the question carefully. They'll take the time to follow instructions and take the time to produce the answer that the teacher is looking for. Now, as you would imagine, reflective thinking is correlated with better academic outcomes. So there's a few things listed here. Reflective students tend to do better at remembering structured information, reading comprehension, problem solving and decision making, goal setting, having high standards for performance. You can see how these kinds of things would typically do better if you take time and put in more effort into your work. So the difficulty here then is if you have a student that is impulsive in thinking style, is there anything you can do about that? And I think there is, at least to a certain extent. I think that some students may not even be aware that they're doing this. This is just kind of something they've always done, where they just kind of rush through their work and do it sloppily. And so I think having students redo their work, making them take their time, reinforcing students, and we'll talk more about behavior modification later, but reinforcing, rewarding students for taking time to double check their work might be also something to consider here. So on a related note, we can also have deep learners versus surface learners. Now, a surface learner might even be a little bit reflective in their thinking to a certain extent, where they do take their time to go through and produce the answer that the teacher is looking for. But the difference is, with a surface learner, this is an individual that learns the material in a shallow way, enough to apply it in their current setting, but doesn't really learn the information enough to retain it or to use it in the real world. So surface learners tend to be passive learners. They're not actually doing anything with the information. They want you to give them the information, they're going to memorize it, they're going to spit it back out on a test, and then they're going to go on with their life. Now, one thing to note is that we are probably all surface learners in certain areas. There are certain skills, certain types of information that you just don't find that important. And so maybe you memorize something long enough to use it and then you're done with it. So surface learners, though, tend to not really tie this information to a larger framework, so not really understanding how this information connects with other meaningful things in their life, and tend to focus more on external rewards. So maybe memorizing this to get a grade, for example. On the other hand, we're contrasting this with a deep learner Someone who has more of a deep learning style is someone who is actively involved in the learning process. So you're not just teaching at this individual, the person is listening to you, but also thinking about ways to apply that information, thinking about ways to use that information inside the classroom and outside of the classroom. And so they tend to give meaning to material, thinking personally about their own examples. This is one way that's great to study. You know, as I go through and talk about different concepts, I try to give examples of some of these things, but if you can think of your own examples, you'll remember those a lot better than you'll remember my examples. They tend to be focused more on internal rewards, kind of learning for the sake of learning. And so because of that, they tend to be more self-motivated. Maybe they don't necessarily need as much motivation from the teacher, although I would still encourage teachers to reinforce this behavior and to show students that this is meaningful so they don't feel burnout. Even if it's something that you enjoy doing, it's still a good thing to be encouraged in that from time to time. All right, so that was just a brief discussion of some different styles. From pretty much the rest of today's lecture, we're going to be talking about some issues that can come up in students that you may see in the classroom or you may see in individuals around you in your personal life. So we're going to be talking about some disorders and disabilities that are relatively common in an academic setting. Now, what I want to say before I get any further into this is that we're going to be using the information and the terminology from the DSM. So if you're not familiar with the DSM, that's the Diagnostic and Statistical Manual of Mental Disorders. It's a very large book that clinical psychologists use to diagnose disorders. So in this book, which is currently in its 5th edition, there will be a list of all the different potential diagnoses that a person could give, as well as the criteria that have to be met in order to meet those diagnoses. And so we're going to be using the terminology from the DSM. So when we talk about learning disabilities, there are many different terms that people use. You might hear things like dyslexia, for example, which a person is referring to someone who has reading disabilities. Technically, according to the DSM, the right way to say this would be a specific learning disorder with impairment in blank, and then you fill in the blank. So it could be with impairment in reading, could be impairment in writing, could be impairment in math or in oral skills. So specific learning disorder is the terminology that the DSM uses. Now, what does this look like? Well, when you're trying to assess and diagnose a child that's having difficulty in the classroom, you're going to give them some different tests. We talked last lecture video about intelligence tests. So you would give a child an intelligence test. But in addition to an intelligence test, you would also give a child an achievement test. Now, an achievement test is in some ways similar to an intelligence test. They are standardized tests. They have been verified to make sure that they have validity and reliability and all that good stuff. But an achievement test is a little bit different because an intelligence test aims to measure your potential for learning, whereas an achievement test aims to measure specific information that you should have already learned. So you're still going to be compared with your same age peers. But instead of measuring like spatial reasoning, patterns, that kind of thing that you would see on an intelligence test, with an achievement test, you might actually be asked to solve math problems. It's a little bit more like what you would see in a classroom. So what we see typically is that children who have learning disabilities have normal or maybe even above average intelligence on an IQ test, but their performance in a particular area on an achievement test is low. So what we're saying is there's no reason based on your intelligence for you to not be successful in math. Your intelligence is what we would expect based on your age, but your math performance on an achievement test is very low. That's when a person might be diagnosed with a math disorder or specific learning disorder with impairment in math, I should say. The same would be true for reading. If you have typical verbal comprehension on an intelligence test, but on the reading portions of the achievement test you struggle, then potentially that could be a learning disability. Now, when someone has a learning disability, What we are not saying is they cannot be successful. Someone who has a learning disability can be successful in learning in the area that they struggle. The difficulty is it takes extra work. It usually takes extra encouragement, it takes extra one-on-one tutoring, but it is certainly possible. So yes, learning disabilities tend to have a lifelong impact. There are some disorders that happen in children that tend to fade as individuals get older. Learning disabilities do not seem to fall in that category. Some correlated outcomes here, poor grades, high dropout rates, employment issues, maybe some difficulties with post-secondary education, that kind of thing. You can imagine that if, for example, a person had a math disability, then having to take college algebra and statistics in undergrad would be a very stressful experience for them. So these are correlational though, and we're saying that they often go together, but it is possible for a person to have some success, but the best outcomes happen when we diagnose early and when we get an individual into the kind of tutoring that they need. So for each one of these categories we're going to be talking about, there's a little bit of advice here about ways to work with students who have this particular problem. So when it comes to learning disorders, taking the needs of the child into account during instruction as much as possible. Of course, when you're a teacher and you have 25 or 30 students in your room, I understand this is a challenge for sure. But thinking about this child, their zone of proximal development is not where everyone else's is, perhaps, but they still have a zone of proximal development. So keeping that in mind. Providing accommodations, so sometimes students who have learning disabilities may also have test anxiety, may have had some bad experiences. So providing a quiet, calm place for them to take tests and potentially giving extra time to take tests or to complete assignments can also be very helpful if you're able to do that. Sometimes part of the problem might be a learning disability and part of the problem might just be study skills that may be lacking. So improving organization and study skills, helping students figure out the right way to take notes, for example. It depends on the age of the student that you're working with. If you're working with young children who have learning disabilities, they probably have not yet found strategies that work for them. And as you get into like older grades, as you get into college, students often have figured out ways to study, ways to take notes that work for them. But you could be the teacher that helps the student figure out what works and what doesn't work. Obviously, work on whatever the skill is. So if it's a reading issue, writing issue, if it's a math issue, the individual may try to avoid that. And you have to understand why. This would cause a lot of stress to sit down and try to do your math homework if you were having a major struggle there. However, if at all possible, trying to make it a positive experience, trying to reinforce the student for success, and continuing to work on it, because it's not going to get better if you don't work on it. And challenging students. This is going to be a theme throughout today's lecture. I'm sure it will come back up, but you often get from other people what you expect to get from other people. And this is true in the classroom as well. So it is appropriate, it is important to have appropriate expectations, is what I mean to say. So if, on the one hand, there's a teacher that says, well, students who have learning disabilities cannot learn, then that teacher will not pour into that child, will not work with that child, will not help that child improve, and therefore that child probably will not learn. This is a self-fulfilling prophecy, the idea that you behave in ways that make your beliefs come true. So if you believe this child will not be successful, then the way you interact with that child may make that child not successful. On the other hand, you may have some individuals that would say, well, learning disabilities are not real. So you just need to do exactly what everybody else is doing. And that's also detrimental because the student needs some specialized care here. You wouldn't believe the number of individuals who deny the validity of psychological issues. It's kind of a personal pet peeve. But moving on, I can't promise that won't come back up. ADHD. Now, once again, we're using the DSM terminology. I do understand that some individuals prefer the term ADD. I think that happens because they say, well, I don't have hyperactivity, so this is not the correct term for me. Well, technically, according to the DSM, the proper diagnosis is attention deficit hyperactivity disorder with a specific presentation. So you could say ADHD with an inattentive presentation, or you could have ADHD with a hyperactive impulsive presentation, or you could have ADHD with a combined presentation where the individual meets criteria for both the inattentive type and the hyperactive impulsive type. So even an individual who is not displaying all the symptoms of hyperactivity would still technically meet criteria if they were having the inattention that goes along with it. So ADHD is the terminology we're going to use. Now, with ADHD, the onset is typically in early childhood. We would not diagnose an individual with ADHD if the symptoms didn't start in early childhood. So if you've had normal attention span your entire life, and then as an adult you start having attention problems, I'm not going to go ADHD. That's not going to be my instinct. My instinct is going to say, okay, well, let's see if there's something else going on. Because things like anxiety disorders, depression, substance use, and other things can impact your attention. Or sleep. If you guys are not sleeping, I'm not your mother, but I am somebody's mother. If you're not sleeping, getting, at least 7 or 8 hours every night, then it's going to be hard for you to pay attention. So if an individual is an adult, we can still diagnose an adult with ADHD if they can look back and say, yes, these symptoms have always been there, and just maybe for some reason that they weren't recognized, they weren't diagnosed earlier. So the onset is typically in early childhood. When we talk about what makes something a disorder, that's an interesting question because, for example, everyone has trouble paying attention sometimes. So when would we say that it's severe enough to be ADHD? Everyone is sad sometimes. When will we say it's severe enough to be depression? Well, in abnormal psychology, we talk about the 4 Ds. About deviance, is this something different from your same age peers in your society? Deviance, distress, does this cause you emotional problems? Dysfunction, does this keep you from functioning in your daily life? And danger. So typically what we're looking at with ADHD, we're going to ask the question, well, is there dysfunction? If you say, well, I have a hard time paying attention, but you still have great grades and you're still doing well in all the other areas of your life, then we might say, well, you don't meet criteria because there's not a dysfunction there. So typically the symptoms will require that they're causing impairment in some way. And this is not always impairment in the classroom. Sometimes people who have ADHD also have impairment in relationships and things like that, and just self-care, daily functioning, depending on the severity. And something we also see is that, especially for women, there is a correlation between ADHD and emotional things like anxiety and depression as well. Although we're not sure exactly why we see that relationship, but we often do. Now, how are we going to intervene? Well, probably when I say ADHD, the first thing that comes to mind would be stimulant medication. And it's shocking, the number of children that are taking stimulant medication. Don't quote me on this, but I think it's something like 3% of school-age kids are taking some form of stimulant medication. So it's a relatively high percentage. So yes, there's certainly a lot to consider when you're deciding about whether or not you want to medicate a child. Obviously, if the ADHD is causing severe dysfunction, then that's something that's harmful to the child. You'd be worried about the child getting behind and not being able to catch back up, and I understand that. But you also need to be aware that there are side effects associated with stimulant medications. In addition to psychological side effects, also there can be physical side effects. There often are growth delays in children who've been taking stimulant medications, which is why they often recommend a drug holiday. So over spring break, summer break, Christmas break, having children have some time when they are not taking the medication so that they can then catch up a little bit in their growth. Now, that's not the only thing you can do for children who have ADHD. There are academic and behavioral things as well. So let's think a little bit about how to work with students who have ADHD. First of all, if you have a student in your classroom that is receiving medication it's a good idea to keep an eye on that child, just to look for things like side effects. And also you want to make sure who is administering this medication. Sometimes ADHD medications are given in the morning, and then maybe we need a second dose later in the day, something like that. So who's going to be administering it? Are you supposed to be involved in administering the medication? That kind of thing. And just looking for side effects and issues there. But some of the behavioral things that you can do. First of all, repeat and simplify assignment instruction. So you want to have appropriate expectations, also taking into account the age of the individual. But the best thing to do is to make the instructions simple and to repeat them over and over again, and not expect that the child's got it once you've said it one time. So if there's a multi-step assignment, first make this list and then write out this paragraph. You need to make sure that the student has the instructions in front of them in a simplified format where they can understand, but then having them break it down one step at a time, because too many steps at once is confusing for anyone, but especially for students who have ADHD. Having clear expectations and giving immediate feedback. You have expectations about what students should be doing as far as their work is concerned. You also have expectations about how they should be behaving in the classroom. And when it says give immediate feedback, that should not always be negative feedback. If you see a child doing something right, then rewarding them for that, just praising, just a good pat on the back, you're doing a great job, I saw what you did there, that was good. Giving that child immediate feedback so they know how to change if there's something that needs to be adjusted. Providing structure. It's my personal opinion that all individuals do better with at least some level of structure. Some of us need more structure than others, but maybe having a schedule that's pretty consistent from day to day would be especially helpful for students who have ADHD. Providing opportunities for students to get up and move around. I think all students benefit from this, and the younger the student, the more they need this. But even college students, I don't know what the longest class you guys have taken would be, but I know that there were times in my academic career when you take a 3-hour class, you need a break. You need a chance to get up, stretch your legs, go to the bathroom, get some caffeine, do something. And we're adults, right? We're supposed to be able to sit still and pay attention. Sometimes I wonder, I look back and I think, how did I sit through 8 hours of high school? Like, how did I do that? Because in college, you very rarely sit down and have 8 hours a day of classes. But anyway, that's a whole nother conversation. Everyone benefits from getting up and moving around. And maybe you can find ways to incorporate this in the classroom, so physical activities that also reinforce what you're learning. And breaking assignments down into shorter bits instead of having large projects, maybe focus on one section of that project at a time, and then over enough time or maybe over multiple days kind of put all those pieces together. All right, intellectual disability. Now, when we're talking about intellectual disability, you need to really be thinking back to the information from the last lecture video about how we have intelligence tests that are intended to measure a person's potential for learning. And on a Wechsler test, the average IQ score is 100. And the majority of people, almost everyone, is going to fall within certain ranges. But there will be some individuals who have very, very high IQs, and there will be some individuals who have very low IQs. So when we talk about intellectual disability, first of all, there are 2 criteria that need to be met. You need to have an IQ score of less than 70. I'll talk about that in a second. And deficits in adaptive functioning. And you have to have both. If you only have one and not the other, then we might be considering some different diagnoses here. Now, first of all, your IQ score is less than 70. That's not necessarily a hard and fast rule, although for the purposes of this class and for the purposes of the test, that's the rule. However, if you have a person who has deficits in adaptive functioning and their IQ score is 72, 73, then you may very well still make that diagnosis. The reason why, like I said with the last lecture, if a person maybe doesn't get a good breakfast or they're in a bad mood, they didn't sleep well, then that might decrease their score a little bit. But if you had a great breakfast and you slept really well and you're having a great day, that might artificially boost your score a little bit. So a person who has a 72 might very well have made a 69 on that test if they'd taken it the next day. And that, in combination with deficits in adaptive functioning, says that there is something going on. Now, when I talk about deficits in adaptive functioning, I'm just talking about a person who has difficulty in day-to-day life. This could be problems with academic functioning, so you do usually see people who have intellectual disability also have problems in the classroom, but this could be social issues, this could be self-care issues, this could be work-related issues if the individual is old enough to work. Now, intellectual disability, like most things, comes on a range. So there will be some individuals maybe who are right at the borderline there, and then there'll be some individuals who have more profound intellectual disability. The lower the IQ score, the more severe the deficits in adaptive functioning, typically the worse the outcomes are in these situations. Now, if a person has a milder form of intellectual disability, so we're talking about IQ scores in the 60 to 70 range perhaps, in those situations it could be genetic and it could be biological. As that IQ drops, it tends to become more biological. So with individuals who have IQ scores a lot lower than that, then that's typically something biological that happens. Could be a genetic problem, could be a chromosomal abnormality, that kind of thing. Typically, a bad environment does not cause profound intellectual disability, but it could cause a more mild intellectual disability. So examples of genetic factors, things like Down syndrome, trisomy 21, individuals who have Down syndrome often do have intellectual issues as well as issues in adaptive functioning. That's not to say that they cannot learn, they certainly can, but it's going to require a lot more patience, and we're going to have appropriate expectations there. But in addition, there can be some things like infections, environmental hazards. These could be things that happen in childhood and early childhood, but could also be something that happens during pregnancy. So it talks about fetal alcohol syndrome. Fetal alcohol syndrome is the most common preventable cause of intellectual disability. And just as it sounds, this happens when a mother consumes alcohol during pregnancy. Now, I do understand that this is a controversial topic and a topic that many people have different opinions on. Because of, think about the nature of the research here. I cannot do an experiment in this area. I cannot randomly select a group of pregnant women and give some of them alcohol and give some of them no alcohol and then compare the outcomes of their babies. I can't do that. That's unethical. That would be appalling. However, because we can't do that kind of research, then we have to do things that are more correlational in nature. So we do know that there is an association between alcohol consumption during pregnancy and then children that go on to have intellectual problems as well as physical health problems as well. So the safe amount of alcohol to consume during pregnancy and breastfeeding is 0. And please don't get that question wrong. If that's a test question, the safe amount of alcohol to consume during pregnancy and breastfeeding is 0. We do not know at what point it starts to cause problems, and so the best recommendation is to avoid it entirely. As far as other drugs and medications go during pregnancy, there's always reason to be cautious. I would encourage any individual watching this to consult with a physician about that. Now, one other thing I didn't mention is it says that the onset has to be before age 18, and typically the onset is during early childhood. The more severe the symptoms, the earlier we usually see it. But one thing to say is that if these symptoms start to come up out of the blue after age 18, we wouldn't call that an intellectual disability. Someone who's had typical intelligence, typical functioning, and then all of a sudden starts having problems, we might be thinking about substance use or perhaps traumatic brain injury, that kind of thing. All right, how do you work with a student who has an intellectual disability? Which could be environmental, from abuse, from neglect, from lack of stimulating environment, or could be genetic, could be biological in nature. So first of all, it talks about individualizing instruction, which is a good idea for all students, but keeping in mind that zone of proximal development. But in addition to that, students who have intellectual disability, it is not that they do not learn. It is not that they do not develop. They learn and they develop more slowly. So they're probably going to reach their milestones later. So their language will probably happen later. Walking will probably happen later. So these milestones, although they may happen, probably happen at a later age. So we're just going to be thinking about children that are on a path to a certain developmental point, and it just takes them a little bit longer to get there. So if we're thinking back to our Piaget conversation about different stages of cognitive functioning, sticking with concrete examples, you may need to stick with concrete examples much longer with the individual who has intellectual disability. They may need a lot more hands-on practice with concrete examples, but that kind of formal operational thought is something that, if it happens, will happen much later for them. So making sure that you keep those tangible, hands-on, manipulative things for them. Giving them lots of opportunities to practice and a lot of encouragement and rewards and reinforcements. Having positive expectations. This goes back to what I said earlier about teachers who think that an individual, because of a disability, cannot learn. If you have that belief, then it typically comes true. I have seen research where they took a group of average students and they gave them to a teacher who knew nothing about them, and they told the teacher, these students are gifted, and by the end of the time period, they were gifted. And then you take students that are average and you tell the teacher they have special needs, they are in special education, and by the time you were done, they needed special education. It's because the way that the teacher interacts with the students and the expectations the teacher has for the student is very important. Looking for resources. Now, the resources that you have may vary depending on what school district you're working in, how much money is available. Can you have a TA? Can you have maybe a school psychologist that meets with the student, that kind of thing. Also, make sure to connect with families, talk to parents about strategies that they're using at home, or maybe other kinds of professionals. Sometimes individuals who have intellectual disability see speech pathologists, that kind of thing. So working together with a group of individuals for the best outcome of the students. So if that were not enough, also you may see a very wide range of physical issues in the classroom. Now, we could have an entire lecture just on this, but I just mentioned a couple here. Orthopedic disorders. So you may have children who are in wheelchairs, or you may have children who have difficulty moving around. So just like I said with the previous issues, you want to touch base with parents, you want to touch base with other medical professionals to find out what the student needs to try to help the student feel comfortable in the classroom. You want to check on any medications that need to be given, that kind of thing. In addition, if you have a student in the classroom that has some physical issues, then this may be a situation where you need to talk to the class at large and the other students and help them to be accepting of that student, to try to nip any bullying in the bud, to try to make sure that students are kind towards each other, because sometimes, unfortunately, if a student for whatever reason is labeled as different, then sometimes that causes children to be cruel. In addition to orthopedic disorders, I included seizure disorders here. This is something that you may very well see in the classroom. I also include this because I have a daughter who has seizure disorders, and so this is a subject that is near and dear to my heart. Now, what you do need to know is that there are many different types of seizures. It does not always look like a grand mal, falling out in the floor seizure situation, although that may happen. There are some students that have more absent seizures, where it's more like they kind of lose touch with reality for a minute. And then when they come back from that, might be distressed, might have some symptoms, or it could be something that's localized to like a particular area, like their left hand, for example, that kind of thing. So with a student who has seizures, you want to make sure that you're talking to parents and medical professionals about trying to reduce anything that could trigger a seizure. So, for example, certain types of lighting can be an issue when it comes to seizures. Anything that flashes, strobe lights, bright lights, maybe bringing a projector into the classroom, that kind of thing could potentially be an issue. So making sure you're finding out about triggers for seizures. Also, harkening back to the ADHD conversation, you need to ask about medications. Sometimes individuals who have seizures have some emergency medication that needs to be given if a seizure is lasting for a certain amount of time. If an individual does have a seizure in the classroom, you want to make sure that you clear a path around them so that they don't hurt themselves. So a student who's having a seizure could potentially knock over a desk onto themselves, hit their head on something. So clearing an area, kind of cradling the head if possible, listening to make sure that the individual is breathing, that kind of thing, as well as trying to manage the other students in the classroom, because if a student has a seizure in your classroom, that's very likely to cause a lot of commotion among the other students as well. So have a plan in the back of your mind about how to respond to that, and make sure that you have discussed that plan with parents and other relevant adults. All right, in addition, you might have some students who have sensory disorders. So when we're talking about sensory disorders, primarily in a classroom, you might see visual issues and hearing issues. So first of all, when it comes to visual issues, there may be some students who have low vision. So students who have corrective lenses and can see to a certain extent, but may still have some difficulty seeing. So there are certain accommodations that you can make, putting the student at the front of the classroom, providing access to information outside of the classroom. So I've worked with students who have visual impairments before, where if you can give something on a computer, maybe they have a computer where they can blow something up to a large enough size that they can see it, that kind of thing. But then there may be some individuals that would be classified as educationally blind. They may have no vision at all, or what vision they have, they're not really able to use that for learning. So in those situations, then you might be thinking about hearing, touch, so Braille could be something that could be considered here. And then also, when we talked about hearing, any recordings that you can make so that students can then listen to that. So think about how hard that would be for you. If you had a visual impairment, then you wouldn't be able to take notes really, or to go back and review materials in that way. So having a recording of something that you can listen to over and over again can be really helpful. But then you may also have students who have hearing impairments. So these, once again, similar to your visual impairments, there may be some students who just have hearing difficulties and may have devices like a hearing aid. You may have to wear a special microphone that allows an individual to hear through their hearing aid, that kind of thing. But then you may have some individuals that are deaf, that cannot hear at all. So there are different approaches here, things like lip reading, and we're going to have some discussion about this in a second on the next slide. But lip reading, making sure that you're facing the students so that they can see your lips moving, but then also things like sign language. Now this may not be something that you're able to do in the classroom, but this may be something that if you have some resources there, you have another person in the classroom to help you with, that would be fantastic. So when we're talking about working with students who have a hearing impairment, being patient, you may have to repeat things, that's okay. Also figuring out how to not overcompensate. I know that I have personally taught lectures knowing that there was a student in the room that had a hearing impairment, and I feel like I probably yelled way more. I'm naturally a loud person, but I feel like this poor individual was probably turning down the volume on the hearing aid, trying to tune me out a little bit, because I felt like I had to shout. I felt like I had to talk more slowly, and so learning how to speak normally, and it just takes comfort. You have to get comfortable with that situation. Anything you can do to reduce distractions and background noise is good for all students, but especially for students who have hearing impairment. Facing the student, if you know that the student is going to be reading your lips, seeing your gestures, if you're doing any kind of sign language, being aware of how you position yourself in the classroom. And then any kind of recordings that you can give that could be potentially played through another device that can make it louder, go through a hearing aid, that kind of thing is helpful. But a student that has severe hearing impairment, maybe not in the typical classroom, maybe in a special education or in a special setting where they're able to get what they need. All right, autism spectrum disorder is another disorder that is commonly talked about. Now, in previous versions of the DSM, we had a category of pervasive developmental disorders where autism was listed as well as some other disorders, including Asperger's disorder or Asperger's syndrome. But DSM-5 has kind of collapsed those together into one diagnosis, which is autism spectrum disorder. So someone who previously would have been diagnosed with Asperger's syndrome might now be diagnosed with autism spectrum disorder mild. Basically, they decided that there was not enough of a distinction between the two to call them separate disorders, so they just have autism spectrum disorder, mild, moderate, severe, that kind of thing. Now, individuals who have autism spectrum disorder often have some core issues. Social issues would be probably the one that comes to mind first, but then also some communication problems, as well as it talks about restrictive, repetitive, and stereotyped behavior patterns. So children who have autism spectrum disorder may have some interests that other people consider odd, or that they're really focused on one particular thing at a time, and can become very upset if they're interrupted or if they're not able to do what they want to do in those particular areas. So maybe those limited interests, there are only a few things they enjoy doing and they want to do them for very long periods of time. Now, the previous distinction that was drawn between autism and Asperger's syndrome primarily had to do with intellectual functioning, I think. That individuals who had Asperger's syndrome might have some of these social issues, may have some communication issues, and so on and so forth, but typically did not have the intellectual issues that we tend to see in individuals who have autism spectrum disorder. But nobody asked me. They combined those together in the DSM-5, so we're going to go with autism spectrum disorder. Now, the onset is within the first 3 years of life. The more severe the symptoms, typically the earlier it is that we recognize this. Some of the things that you'll see in very young children have to do with play. So do we make eye contact? Do we model the way that adults play? Do we try to include other people in our play? That kind of thing. Although it is sometimes difficult to diagnose autism spectrum disorder in a very young child, and so that would have to be a trained professional with a lot of assessments that they're using to help them come to that determination. So when it comes to, I thought there was another slide there. When it comes to autism spectrum disorder, this is something that a lot of talk goes on about autism spectrum disorder, and I think that it is because research has shown an increase in the number of individuals who are diagnosed with autism spectrum disorder. And so we're asking ourselves the question, why is it that autism spectrum disorder seems to be increasing? And there are a few different potential answers for that. It could be that we're actually not having an increase in autism spectrum disorder. We're maybe better at recognizing it and diagnosing it now. And so whenever you see an increase in a particular diagnosis, there's always the question, well, have we just come up with better tests for it? Are we more aware of it? And that's potentially the case. There are certainly some individuals that would argue that there could be environmental causes that could potentially be increasing autism spectrum disorder. The one that people tend to go to first would be vaccinations. Now, what I will say is that I am not a medical professional, and so I would encourage you to seek out the advice of a medical professional before you make important decisions in your life and in any children's lives. However, a lot of the initial research on the relationship between autism and vaccines was falsified, was not well done, and so I would encourage you to look into that more yourself. All right, having said that, you may see also a wide range of emotional and behavioral disorders in the classroom. So some of the most common ones may be students who have anxiety, students who have depression, as well as potentially students who have aggressive behaviors in the classroom. Now, hopefully you're in a situation where you have some support here, where you have maybe some psychologists in the school that are working with students that are there to help, having some support. However, you being the teacher in the classroom, or maybe the one that first recognizes that there's something going on. Now, think back to our criteria about when something becomes a disorder. Is this causing danger to the student or to someone else? Is it causing emotional distress? Is it causing dysfunction? So does this harm academic performance, relationships, that kind of thing? And you would also look for deviance. So is this child different from their same age peers in their culture? Now, when it comes to aggressive behavior, this is something that all teachers need to have a plan for how to respond if you have aggressive students in the classroom. And part of this does depend on where you're teaching and what age group you're teaching. As a college professor, I have never felt physically threatened by one of my students, and I hope to keep that streak alive. But when you're working with younger children who may have less emotional control, then you may be concerned about the children hurting each other, hurting themselves, or even potentially hurting you. So what we typically see is that children who show this aggressive pattern of behavior often do have emotional issues as well. So it's going to say here that this happens more in boys than in girls. And this is true, that externalizing things like violence and substance use tend to happen more in males, whereas internalizing problems like anxiety and depression tend to happen more in females. There's a theory, though, that perhaps the underlying psychological cause is the same. We just express them differently because we encourage aggression more in boys. We discourage aggression more in girls. So typically we do see there is an emotional issue for students who have aggressive behaviors, and it could be because there's a problem at home, there's neglect, there's abuse, but also there could be a genetic component here, hormonal issues here that could be at play. So these are individuals that engage in aggressive, deviant, defiant, dangerous acts. So they are doing things that could potentially hurt themselves or potentially hurt other people. This obviously is something that needs to be responded to immediately in the moment to prevent danger and also to communicate that this kind of behavior is not acceptable. We will talk more about how to reduce problem behaviors in our behavior modification lecture, but you would want to check with your supervisors to make sure that you are following policy. I'm sure most schools have policies about how to handle this situation, how to handle a first offense, second offense, so on and so forth. What you have to be aware of, though, is that sometimes the things that we do to intend to punish an individual might actually be reinforcing for them. So, for example, when it comes to yelling at a child, if a child wants attention, then yelling is still attention, even if it's negative attention. So we'll talk more about how to stop that when we get to our behavior modification lecture. We do also see that this occurs more in low socioeconomic students, so we're talking about more in individuals living in poverty, and this could be a stress-related issue. All right. So in addition, you may see some emotional problems in students. So depression is something that happens more in adults, can happen in adolescents. It is even possible that it happens in young children. It can be diagnosed in very young children, 5 or 6 year olds, although it's hard to imagine diagnosing a 6-year-old with depression. But certain medications for depression, things like Prozac, can be given to children as young as age 6. The fact that I'm saying that is not me fighting for that in any way or endorsing that, but that is potentially possible, so just be aware of that. But it's more likely to happen in adolescents, more likely to happen in girls. As I said, females are more likely to be diagnosed with things like depression and anxiety. Now, depression has to have one of 2 core symptoms, and then a few other symptoms. So the core symptoms would be depressed mood, first of all, or a loss of pleasure, which is called anhedonia, basically not enjoying things that you used to enjoy. So you have to have one or the other of both of those. And then in addition to that, you can see sleep problems, so sleeping more or sleeping less, appetite issues, so people could be eating more or eating less, behaving lethargically, so that fatigue, low energy, not moving around a whole lot, and then certain thoughts and feelings, worthlessness, hopelessness, suicidal ideation could potentially become an issue here as well. So depression may be something that you recognize in the classroom, probably not something that you treat in the classroom. This is probably something where you refer to school psychologists, refer to a counselor. Typically we have behavioral therapies that we do with younger individuals that can be very effective for depression. In addition to that, you may also see students who have anxiety disorders. Of course, this is kind of a general overview today. This is not abnormal psychology. There are many different anxiety disorders, but anxiety in general involves vague, highly unpleasant feelings of fear and apprehension. Anxiety happens when you have a fear response that's not really appropriate, it's excessive, or maybe there's not really anything here to actually be afraid of, but a person starts to feel this anxiety. If a person is experiencing anxiety, that can then make it hard for them to do well in school because of things like test anxiety, first of all. We all know what it feels like to have anxiety during a test, but some individuals have extreme test anxiety. But even if it's not test anxiety, even if they're worried about other things, it's very hard to concentrate when you feel incredibly anxious. When you're having a panic attack, how are you supposed to be taking a test? So referring students to school counselor, this may be something that you see in the classroom, but once again, probably not something you treat in the classroom, but something you might keep an eye on and make special accommodations for. Once again, behavioral therapies tend to be effective. All right, so activity 5 asks you to think about a real life scenario that you might run into here. So imagine that you're a first grade teacher. You have a student that's an 8-year-old girl. She's previously repeated kindergarten. Now she's repeating first grade. So we're definitely seeing some dysfunction here. The girl has significant difficulties with reading and writing and less significant difficulties with math. She's been diagnosed with ADHD and intellectual disability. So I want you to use the information from today's lecture to think about what are some specific concrete things that you can do in the classroom to help her. How can you get the best out of her? Making sure that you're thinking about things like giving accommodations, you're thinking about things like having appropriate expectations, being encouraging to this student who has obviously had a lot of difficulties. So activity 5 asks you to practice what we've been talking about today. So let me know if you have any questions with that. The last thing we're going to talk about today, really we're going to be focusing on the legal aspects here when you are educating children who have disabilities. So the Individuals with Disabilities Act, which is referred to as IDEA, was initially introduced with the intention of trying to make sure that all individuals receive an appropriate education as much as possible. And once again, I say as much as possible because this depends on how much money and the resources that a particular school district has. So first of all, children in a public school, this does not necessarily apply to children in a private school or other type of school, but children in a public school have a right to be evaluated to determine if they are eligible for special accommodations. Now, you get whatever assessment the school system can provide, but working with the school to make sure that there's an appropriate assessment conducted, and then once the assessment is conducted, you look at the results and determine, is there a diagnosis here? Is there something we could be doing better? And then once you come up with that diagnosis, then you come up with a plan, and this plan needs to be followed as much as possible. It's called an IEP, an Individualized Education Plan, to help everyone involved with the student to get the best results for the student. And so typically parents will be involved in figuring out the details of the individualized education plan. School psychologists may be involved, principal may be involved, teachers obviously need to be involved. So an individualized education plan tells us exactly what we're going to do for this student. And in addition to that, students also have a right to the least restrictive environment in which they can be successful. This is the LRE. Basically what we're saying here is that if a student can be successful in the regular classroom, that's where they should be. We should not restrict them if they can be successful. But if a student can be successful in the regular classroom, if they get a little extra tutoring during certain periods of the day, and they can't be successful without that tutoring, then get them the tutoring. It may be that a student can only be successful if they're in special education for the majority of their day. And if that's the least restrictive environment that they can be successful in, then that's what we should do. But trying to incorporate students into a regular classroom as much as possible. And then some additions here that we've made. Positive behavioral support, we're going to talk a lot more when we talk about behavior modification. But reinforcing good behaviors, encouragement, that kind of thing, as well as functional assessments, which we will also talk about in our behavior modification section. A functional assessment basically involves an individual, whether that be a parent, psychologist, or a teacher, conducting a little experiment with the individual to try to determine the cause of problem behaviors. And so we'll get into more detail about that later. So students who have disabilities in general, you need to follow that individualized education plan as much as you can. Seek out support as much as you can. Maybe this could just be doing research into what's worked with other children. Maybe if you have a child coming into your classroom, go talk to other teachers who have had that child and try to find out what they did that worked and what didn't work, so that you can be better prepared. Being knowledgeable, as I said, some teachers think that things like ADHD and learning disability don't exist, and so they don't make special accommodations. And on the other hand, some teachers think that they're so severe that the child cannot learn. Either one of those is going to be negative. So being careful about your expectations, which goes into labeling children. Unfortunately, sometimes children get a label in a classroom. This is the hyperactive student, or this is the slow student, whatever label gets put on students. And then the teachers treat them that way, and then they become that just because of the label. So being cautious with that. Remembering that all children benefit from some of the same teaching strategies. All students do better in their zone of proximal development. All students do better when they have hands-on learning that they can get up and move around. All students do better with instructions that make sense, with positive reinforcement, that kind of thing. And then, as I said, working with the other children in the classroom to encourage them to be accepting, to try to reduce any bullying. You may kind of come up with projects that require students to work with several different students in the classroom, trying to encourage appropriate socialization whenever possible. So our last thought for today: what experiences have you had with students with special needs? Maybe there's been a time where you needed something special from a teacher, or maybe you've seen teachers who had special needs kids in their classroom. How were their needs met? And is there something we can do better? You may reflect back and think about some things that worked really well and you want to incorporate those. But you may have also unfortunately seen teachers respond with anger, with frustration, or with very low expectations. And I ask you to think about this because when you're the teacher, certainly there are other realms of the child's life that are important. But you have an opportunity to make a real difference here. The parents obviously need to be involved and need to be on board. You're not the only determination of how well this child's life turns out. But in a moment, you have a chance to make things better or worse for a student. And so sometimes if you don't have a plan, then you find yourself in a situation where you just don't know what to do. So thinking ahead of time and being prepared about how to work with individuals who have special needs can help you do better in the classroom in that moment. And of course, the more experience you get with this, the easier it will be. Alright, so that is all for today's lecture. Please let me know if you have any questions. Also, remember, Activity 5 needs to be submitted. Make sure that you check your word count, that you have at least 200 words. Let me know if you have any questions about that. Otherwise, we will carry on with this during our next lecture video talking about students who are gifted. So I'll talk to you guys then.